Moving on to Ohio, on Tuesday, a large crowd gathered to hear the debate on Ohio House Bill 68, a new version of the SAFE Act that we saw rejected last year in the form of HB 454. The bill bans gender affirming care for minors, including not only the extremely rare surgery, but also prescription of puberty blockers, and blocks mental health providers from diagnosing a child with gender dysphoria without first screening the child for other medical health conditions and also abuse or trauma. The study cites debunked data as truth that it as it claims that the vast majority of children who are gender nonconforming or experience distress at identifying with their biological sex come to identify with their biological sex in adolescence or childhood. That's a story that we've talked about here. Where that comes from is a study that looked at all children, not trans children, not children with dysphoria. That is incorrect here. It's talking about dysphoria, but it is actually all children who show any signs of cross-sex interest, hanging out with members of the opposite sex when you're young, or playing with their toys or their clothes or anything. You showed any of that, you were lumped into this. And so that's how that data got skewed. And we've seen Republican, right-wing, and conservative organizations citing that study as proof that most people don't continue on with their gender dysphoria into adulthood, and it's just false. This bill would also prohibit Medicaid from covering gender affirming care and require mental health professionals to report the age, biological sex, comorbidities, and number of minors they treat for gender related conditions to the Department of Health every year. The bill's sponsor, Representative Gary Click, said in an unsurprising statement, "I don't believe there is such thing as gender affirming care." In his statement supporting the bill, Click cited widely debunked myths like the danger of rapid onset gender dysphoria and that social media is making kids trans. Again, two things that have been debunked so many times that it's not even worth addressing here. Voices on the side of reason and fact snapped back in full force. Representative Anita Samani said, "You are discounting any organization that does not agree with you. However, the Ohio State Medical Association just this weekend reaffirmed that gender affirming care should be offered. It should not be banned and should not be made illegal by legislation." Representative Beth Liston asked for a statement from Click saying, "I would love your thoughts on why you think that your approach, which goes against all other medical societies, is the best approach." And Representative Munira Abdullahi said, "Doctors are certified on these issues. I respectfully don't see that you had the expertise to make these decisions." So big clapback against this bill. I didn't see anything on what the actual outcome of that debate was. I think they were just debating it. It's the first round of debates, and I believe I would be talking on my butt if I said that I believe that there will be three, because I do not know. So we'll wait and see what happens with this bill.